All right, let's do this. You're watching the Chad and Cheese podcast. I'm your co-host, Joel Cheeseman, joined as always, Chad Sowash is in the house. We are chatting with John Higgins. He's the VP of Talent Management at Essentia Healthcare. John, welcome to HR's Most Dangerous Podcast.
Glad to be here. Thanks for the opportunity, guys.
Who's ready to talk about AI? That's the question.
This guy.
Yeah, right.
To this guy, mate. Looks excited.
Yeah.
Before we get to that, a lot of our watchers out there don't know what Essentia is, what you do. Give us kind of the quick Twitter bio on you and the company.
Yeah. So real quick on Essentia, a large healthcare system based in rural America, really. Northern Minnesota, all of North Dakota, northwestern Wisconsin. Biggest city we operate in is Fargo, North Dakota. We have about 15,000 employees. Full service, integrated health system, with ambulatory care, acute care hospitals.
Keeping the north rural areas ticking.
You got it.
Essentia Healthcare. Who knew?
Which isn't easy, right?
It's not, keeping healthcare close to home. So people don't have to travel to the big city to get care, right? For the most part, most of us have family and friends that, that's their origins, right?
Talk about quickly, you're in the north.
Yeah.
It's cold. You're in rural areas.
Yeah.
Recruiting nurses and radiologists is tough enough.
Yes.
Set the table for us, the challenges you have in that environment.
Yeah, that is the challenge, really, right? The challenge is getting enough talent across the line, right? So as we talk today about things like AI and the type of technologies we might deploy, ultimately, no, it's not to screen people out. It's to get more candidates into the funnel. It's to get sufficient supply. In addition to that, it requires incredible work around workforce development, right? The building capability in our communities, and not just recruiting from outside.
Old school and new school. Let's talk a little bit about the new school.
Yeah.
And this is one of the things that we don't talk about enough, I think. Things are changing so rapidly.
Yeah.
We've always been in talent acquisition and even talent management. We've always been in the set it and forget it mind frame.
Yeah.
Buy it, we set it down, and we expect it just to work.
Yeah.
So tell us about your journey and being able to, again, old school, trying to pull in new school. What did you guys do to ensure that you were solving the problems and you continue to tweak where you need to?
Well, I think it starts with what are the problems, right? Really identifying what are you trying to solve, right? Throwing in technology because it's cool doesn't do you a whole lot of good.
And you don't have budget just to throw.
No, you do not, right? Yeah, you got to have a hell of a business case, especially when you're in nonprofit, rural-based healthcare, right? The margins are so incredibly thin that you gotta make sure that you're getting a return for the business. But that being said, as we look at kind of what we've done at Essentia over the last almost 3 years now, focus was we've got an ERP system that we've got millions of dollars put into with Workday, right? You're not going to pivot off of that real soon, right? That's a massive investment. So, one of the key things that we had to focus on are what are the tools that can, add value to, this back end that you're working with. One thing that I would tell you is that, Workday's current apply process is anything but great. That was probably one of our biggest solve for us is this is not delivering the kind of experience we want from the website to the way that people are able to apply, and our ability to capture that talent, and ultimately, pull it across the line and, get it into this health system that, desperately needs really good people.
Do you have a sense for, because nurses are busy, they're mobile, they don't have time for Workday bullshit. What was it like applying before, the kind of numbers behind that versus going to an AI much simpler process? How did that impact the flow?
Yeah, well, there's a couple things that, we did along with some of our AI evolution. So, we had some tools in place. One of the tools we happened to have in place when we got started was this Paradox tool, but we were using, just kind of scratch the surface kind of capabilities that it offered.
What was that tool that you were using?
So we're using essentially the chat bot on our website to answer really basic questions about about who we were as a health system.
FAQ stuff.
FAQ stuff. That's it. No integration to Workday. No integration to Office 365.
No apply flow.
No apply flow.
Yeah.
It was, what I call tip of the iceberg, scratch the surface kind of thing.
Yeah.
So we went through a re-implementation process with that, where, now people can text to apply, they can chat to apply. The tool will help them find the right opportunities. It allows people, 24/7 by 365 to be able to identify the right role, fill out an application, answer a couple questions, and immediately schedule their own interview with the hiring leader. Between that and some of the other things we did, right, I would note, right, another technology we layered on with that is something called Job Sync. If you're familiar with that capability, that allows, quick applies to come from various sites like Indeed and ZipRecruiter and places like that. Between those two things, we saw a 50% lift in candidates, right? 50% overnight.
Do you know what your rejection rate was before then, where they would start and then they would just eject because it was too much?
Yeah, ridiculous. Like is 25 to 28% would just drop on the Workday apply process. It just disappear, right? So now we're at a place where we're, in the low double digits, 12, 13%, that type of thing. So we've cut it in half, right? At least in half.
So I'm curious, what has that meant to where you were spending money before? Because I assume with that kind of ejection rate, it's like you got to spend more money into the job board industrial complex or on recruiters. So what has that done from a budgetary standpoint?
Yeah, well, it's a couple of things, right? So a lot more in agency spend, right? In healthcare, there's two types of agency spend, right? There's your direct hiring agency spend in terms of I need to hire a nurse, I'm going to pay you to help me, right? And I'm going to pay, average is 25, 30% of a person's salary. So we're using those types of things as well as for executive recruiting. And that's the kind of benefit I'm bringing in terms of top line improvement, if you will.
So is that the focus now? It's okay, let's go ahead, let's take a look at these big areas where we're spending money and let's use technology to be able to bring that in-house.
Yeah, it is, but I'd be remiss, right? It is about the technology, but it's about how the technology impacts experience, right? Because at the end of the day, the tech doesn't matter as much as the experience matters, right? So experience, that drives any kind of decision we're doing with our tech stack.
So what do you mean by experience? Before you had the Workday experience, obviously people were ejecting. Now you've got now what's the more maturation? What is more of a mature experience look for Essentia?
Yeah. So really it's, improving ease to apply, right? You making it simple, right? Rather than, give me your, W-2s for the last 4 years and, I want to know where your grandmother was born and, all of that to a streamlined application. It can be done without, creating an account, without registering, and if you don't want to do that, you just want to, leave some contact information and have somebody call you back. Being able to simply do that as well, being able to use, applications that you have sitting on other sites, whether that's, in Indeed, whether that's at ZipRecruiter, whether that's at LinkedIn, where, hey, I've already filled out all this information. Don't maybe fill it out twice, right? So, simplifying that apply process, is a really significant lift. And then get me the information I need to know on the spot as I need it, when I want it, and as you noted, right? Nurses, they work, 24/7 by 365, mornings, afternoons, evenings, overnights. Serve up that information. Make it easy for them to get the details when it's convenient for them. Yeah.
That is John Higgins, everybody, VP of Talent Management at Essentia. John, for our viewers that want to know more about you or maybe even apply to a nursing job, where do you send them?
You can find me on LinkedIn, JL Higgins on that particular site. But the other opportunity, obviously, is to go to our career site, right? EssentiaCareers.org.
Getting higgy with it. Chad, that's another one in the can. We out.